Hello, everybody. Good afternoon. Dr. Barry. Sorry, running a little bit late. Just had a few patients kind of running behind here. So, like always, we're going to give a couple minutes to let folks kind of get on and let Facebook kind of pass the word that I am running live, and then we'll get started. Very excited about today's Lunch and Learn, and we'll kind of delve into the reason why we started. I'm talking about failures and just kind of what helped motivate me to get from point A to point Z where I'm at right now. So we're gonna give it a few seconds. I'm gonna do like always. Go ahead and like and share when you do get on. For all of your other followers to kind of follow along with the Lunch and Learn again with Dr. Barry. So again, we're just gonna give it a few seconds. Go ahead and share this on my personal page like we do. So everybody get started. So somebody's watching. Oh, hey, Dr. Dre, how's it going? We are just about to get started in a little bit. Today we are talking about some failures and kind of what motivated me to kind of talk about today's Lunch and Learn in just a minute. All right, so our homework is done. Again, I want to introduce myself. I am Dr. Barry, a board-certified internist, founder at drprsblog.com, author, speaker, and now soon-to-be podcaster. I definitely want to thank you for watching another edition of the Lunch and Learn. I think we're on episode 13, which is, crazy. Especially, I was, definitely afraid of, I don't want to say definitely afraid, but I just didn't want to do any, live streaming in this event. So I was definitely slow-footed in that regards. And, thanks to Dr. Dre for kind of, putting that fire to me. As you can see, now we're on episode 13. And, I think we're just getting better and better as we do for the week. So today we're talking about failures. We're going to talk about failing in general. If you had not had a chance, go ahead and check out yesterday's post I did at drprsblog.com/because I failed, or just go ahead and look on my page. You should see my most recent post regarding it. And I felt kind of motivated to talk about failing today on this week's Lunch and Learn. If you don't know, I do teach medical students. I teach medical students from both Florida State as well as Nova Southeastern, which is my medical school that I went to. And I think a very common theme from them, and again, these are medical students. These are, people who, who've, worked all their lives, gotten good grades, did what they had to do, did well on test scores, to kind of get to medical school. And I think a very common theme with a lot of them, and not all of them, but with a lot of them, is that there's still that bit of self-doubt, which is surprising. You think, you've done all the work you were supposed to do. You did well in high school. You did well in college. You're doing well in medical school, because I usually see third and fourth year students. So you're doing well here, but still there's some of that self-doubt where you don't really feel as confident as you should be to kind of get to the next level. And I think one of the biggest issues with that is, I think a lot of them, and this happens with doctors as well too. This is something that doesn't just affect them. This is affect doctors, and this affects non-doctors. My patients deal with it all the time. Is that we have this very self-sabotaging thought process that once we fail, or once we hit one obstacle or bump in the road, that everything is done for. I treat a lot of patients who deal with chronic diseases, including diabetes, blood pressure, high cholesterol, and a very common theme for them, especially, or even I have a lot of obese patients as well. And as exactly, I suffer from obesity as well. So that's something, I deal with on a day-to-day basis. And I think what happens is, once they hit that bump in the road, they want to kind of throw everything up to the wind. They want to say, what, I'm done. I tried my best. I'm here, and I don't want to do anymore. And this is something that I think we have to mentally kind of get over. This is something that and it takes time. It isn't something that we can just kind of brush with the wind. It isn't something that that kind of comes easy, because again, if it did, a lot of our goals and aspirations just wouldn't be good ones if all of it came easy. So when I talk to my medical students, and they have these aspirations, I got people who want to do internal medicine like me. I got people who want to be surgeons, people who want to be obstetricians, people who want to be gynecologists, and all these different medical specialties. But there's always this self-doubt, because they felt that they didn't do well on the test here and there. They didn't do well during a rotation, and they just want to kind of throw everything up in the wind and kind of almost start over. Which is something that I definitely don't encourage. So I always let them know, like, hey, what, I'm sitting here before you today. I am not a person who went unscathed in this process of medicine, and unscathed in this process of trying to get from where you see with the degrees behind me. So and I think sometimes and when I say we, especially the career professionals, we think everyone who's gotten to the point where you want to get to did it easily. Like, there was no bumps in the road. They studied well, they got all their good grades, and there was no problems for them. And that's something that's self-defeating, that I think we have to really encourage, and I have some mentees as well, really encourage our mentees to understand that the majority of people who kind of get to, where you want to get to in life, whether it be, doctor, lawyer, manager, banker, entrepreneur, businessman, millionaire, whatever, the majority of them, had their shares of failures as well. I've had mine. Like, let's talk about, Dr. Barry PL. Let's talk about, what steps and what bumps of the road I had to get to here. Well, let's start at Florida State. I went to Florida State for undergrad, and for those who are aware, organic chemistry is a very big, I like to call it a weed out class for medical students and pre-med students, because they figure out if you don't do well in organic chemistry, there's no way you'll do well in medical school, and you will never become a doctor. So a lot of my pre-med friends at the time, we were thinking like, hey, if we don't do well in this class, it's over for us. We got to choose a whole nother profession. And if you hadn't had a chance to read it, go ahead and check out the Affirmation 2016, just to kind of get a little foreground on what I'm discussing. But you understand that not everything was roses for me. I think, and my first time, and again, I had to take organic chemistry a few times. First time I took organic chemistry, I failed it, right? So I'm not even going to sugarcoat it. I failed. Did not do well. I think by mid-semester, like, mentally, I was like checked out. I said, you know what? No, this is not for me. Maybe I do need to decide, to go somewhere else, because clearly I got this one class that everyone is telling me is the weed out class, but isn't working for me. I didn't do well. I'm not sure what happened. There was a few things that happened that semester, but I just didn't do well. I failed. I said, all right, my career is over, because that's how most pre-meds think. My career is over. I gotta, kind of go back to the drawing board. Fortunately, I had, a lot of great friends around me who kind of rallied me, who kind of supported me during that, that low time for me, and, kind of picked me up and encouraged me to, to kind of keep going and continue on. And, I was able to, I think I took it the semester, maybe a semester or so afterwards. And, again, as you see, I did well, and I was able to kind of, pass that first hurdle. So that was my, pre-med hurdle. That was, and again, or for those who know, organic chemistry, anatomy, those are classes that we have to take because all your medical schools require it. But here I was, a person who failed it. Like, I crashed and burned failed. It wasn't even like I could have maybe had like a D. No, like, it was a strong F. So that was that. So now, I did everything I had to do. I did my volunteer. I got right with my classwork, and I got to medical school. Great. Got to medical school. I did well. I did well during my first couple years during school. Did well on the boards because, for those who may not know, in medical school you actually have to take two board exams before one, especially at Nova. You got to take two board exams just to actually graduate from Nova. So I did well. I did well my first 2 years of like pretty much the book work, and now I had aspirations of wanting to be this internist, and my first 3 months of hospital work was internal medicine. So I said, oh, you know what, this is it, man. This is where I want to be. This is my dream. I need to kind of ball out and do what I need to do there. Unfortunately, I ran into what I like to call the resident from hell. I think her name was like Dr. Dana something. I'm not sure. What I'll do, because of course I wrote a blog on it. I will later on. I'm gonna link in the comments the blog as far as what happened that month. Let's just say that was oh, hey Dr. Sonia, how you doing? Dr. Sonia, a great friend of mine from medical school, has joined the video broadcast. Dr. Sonia, we're actually talking about failures in life in general, and then I'm actually kind of giving some personal failures to kind of encourage my pre-meds and my medical students on this path of wanting to become a physician. And then I'm going to curtail it to like how that kind of relates to just, patients in my practice. So, I ran into the resident of hell, and I failed that. I think it was my second internal medicine rotations. Failed it. She failed me. And there was a whole bunch of like backstory. Hey, Amanda, how you doing? A lot of backstory behind it, but she failed me. So here I was, a guy who had aspirations to become an internist, and like the second month internal medicine rotation, I get an F, right? Bam, crash and burn, fail, and I'm like, oh my god, like I can't, like how can I want to be an internist? Like how, like what's happened here? Like I want to be an internist, but somehow I failed the rotation of internal medicine. So that was very tough for me. Again. Oh, hey, Chessie, how you doing? Again, that was definitely something that I had to learn through. Definitely something that and again, this not only she failed me, like she failed it. She did it so dirty too. Again, I'm not gonna go. I'm gonna put the link to that blog post because that was a terrible tough time for me. But she had it out for me. Fortunately, my mentor, Dr. Hasty, kind of took care of things in that regard. So it wasn't too bad. But like it was definitely a tough time because again, here I go. Again, this is my second, bump in the road. Again, I haven't even officially become doctor yet. I'm still in medical school. I have aspirations to become an internist, but here I go. This resident is telling me I'm not good enough to become an internist. So I had to, again, another episode where I had to kind of internalize that. Fortunately, again, I had a great, circle of friends around me, and that's going to be a very key theme I'll talk about, like your support system around me, just to kind of get me motivated and kind of get me to that the next month. Because even though, especially in medical school, you fail a rotation, you still got more rotations on. So I didn't even have time to even dwell on it because I just had to do well on the next rotation and just kind of keep it moving from there. So that was that. So that was third year medical school. So third year medical school, now it's getting to the point where fourth year is coming up, and we're going to start, start applying to rotation spots, so I can, see exactly where I'm going to end up at from that standpoint there. And now I have to take my second boards, and second boards comes around, and again, I did well, studied, did what I was supposed to do. I failed it again. So no, I failed this. No, I only failed the boards once. So I failed those boards. So my step 2 boards or complex 2 failed it. What's worse, I failed it by like, if I remember, I think I failed it by like 5 points, right? 5 points. And I'm thinking like, this is like 1 or 2 questions. Like 1 or 2 questions is the difference of me passing or not. And I failed it. And so again, so here you go. You got this guy who's been thinking again since I was in elementary school, like, hey, I want to be a doctor. I don't know what else I want to be but a doctor. And I'm right here, I'm staring at a test that's really trying to, 1, hold me from graduating, and 2, hold me from, even getting into a residency. But again, great support system. I did what I had to do, and I took the test over, and I passed it. And then just kind of, fast forward along. I did well. I did well enough during my rotations for my residency spots to kind of overlook that blemish in my academic transcript, and they accepted me. And for the most part, and pretty much during residency, I did extremely well. So I was extremely happy about that. But these were, like, again, three huge instances where my whole life trajectory could have been different. If I would have just accepted the failure. So when I get a lot of students, I teach a lot. I do a lot of pre-med mentoring as well. So when I talk to them, I let them know. I put all my cards out there, like, hey, do not think the product that you see in front of you is the product that was that didn't have any bumps in the road. Like, this is definitely something that took some time, took some grip, and took some hard work to kind of get there. And I use this same method when I'm talking to my patients, because I understand, especially when we're dealing with medical issues, whether it be your blood pressure, whether it be your cholesterol, whether it be we talked about blood pressure, whether it be your cholesterol, whether it be your diabetes. I understand that there's definitely going to be some times where there's going to be some bumps in the road where you just don't do as well as you want to do. If it's due to medication, if it's just due to diet, if it's due to all these other issues here. And as a physician, and it's very important to understand that as physicians, we can't expect perfection out of our patients. So we just have to understand that when they do have these bumps in the roads, we got to be able to be there to kind of help them out and kind of get them over the hump. Again, I was extremely fortunate that every time that on this path of becoming the person I am today, Dr. Berry, that I had someone who was there to say, hey, you know what, don't pay this any mind. You're gonna get over it. You're gonna get through it. You're gonna get better. Because again, like I said, I could have been done in undergrad. I could have been done during medical school. That could have been done during twice. I could have been done twice during medical school, and who knows where I would be at today if not for having that support system there. So it's definitely something that I try to encourage my medical students, and not to to kind of embrace the fear that you can fail, but to also understand that there's gonna be there's plenty of people who failed around you. There's plenty of people who have been in your same position and use whatever they needed to do to succeed. So that's definitely something I wanted to kind of touch on, especially because again, I know we're not going to get political on here, but as of course we had this huge march over the weekend for a lot of people who felt that our political system just didn't do right by us. So the whole failure mantra was kind of in my heart. So I said, oh, let's talk about failure, and let's talk about how we're going to move on. And I'll probably do an Obamacare update on Thursday, because I've been getting a lot more questions on Obamacare just because of things that have been happening since the president has been in office since last week or something. So we'll probably do an Obamacare update on Thursday. But we definitely want to just touch on failures. I definitely wanted to touch on failures. I definitely wanted to touch on some of my personal failures. And the reason why I did that is because, again, I don't want to hold up this facade that I'm 100% perfect. Because again, it's very easy, especially when you tend to see, for most of us, we tend to see the end products of a lot of people, but we don't really see what all they had. Again, I didn't have this Facebook Live following me when I was an undergrad student. I didn't have a camera kind of following me when I was in during my residency. I didn't I talked about it. We definitely. I definitely wrote the blog about it, but it wasn't something that was live and direct there. So a lot of times, when you kind of see, hey, this guy's on Essence, this guy's on, this guy's, in fact, oh, you know what? If you have not had a chance, oh, hold on. Sorry about that. Be more prepared. If you had not had a chance, go ahead and pick up this copy of Essence. It's the February edition. with the beautiful ladies on there, because I do have I am featured on an article. I think it's on like page 100 or something in that regard, just talking about the importance of women and how much they affect the healthcare of men, which is, I can tell you, is extremely important. So go ahead get that Essence magazine today. Essence did not pay me to advertise for them, but hey, if I'm in Essence, and again, this is actually the first time I'm in some type of publication, which kind of gives you like the gives me like a feeling of joy, like I'm in the Essence. Like that's just crazy to think, especially again when we just talked about all of the failures that I've went through. And again, and I can tell you, there's been some issues even before undergrad, but I just want to start at undergrad to kind of say, hey, you know what, I am not perfect. But I'm here now, and not only am I here now, I'm in like Essence, right? Like it's like I'm in here now. So go ahead and get I'm quoted, and I got like a nice little section too, which is even crazy to even think about. Especially with some of the areas where I used to be at now. So again, just to wrap up again, I'm not going to take too long with you guys. I have to run to the hospital. So we talked about failures, and we talked about some some key failures of mine, as far as what I had to do to kind of get to the position I'm at now, where your boy is in the Essence magazine during. And I think it's their February issue too, so it's like their Black History Month issue about to come down, and then I'm in there. So very excited about that in that regards. So again, we got some things again just to kind of take away. So when we talk about failure, especially from a career professional, understanding that a lot more people than we think about goes through them. But the most important thing is like, what am I going to do for this failure? Like, how am I going to get over it? And I think the most important thing is one, a self-belief that you understand that like, hey, I'm going to get over this failure, regardless of what the situation I was put in. Two, having a great social circle around you. And I've had great friends along the way that's kind of helped push me along, and kind of and I thank them as as often as I can to kind of for giving me to this point where I'm at today. And then three, giving back, just making sure that once you do make it to that quote, whatever your promised land is, whether it's having great career, whether it's having great blood pressure, whether it's having great blood sugar numbers, like whenever you get to that point, making sure that you're taking whatever knowledge and whatever skills you learn to get there, and then you're giving back, because there's gonna be people behind you who deal with just as much struggle as you have. So it's one thing, right, for me to take my failures, succeed through my failures, but then never actually tell someone like how to avoid them, right? Like that's just selfish. Like if you know some tricks of the trade to maybe help that your mentee, maybe help that patient in front of you avoid some of the mistakes you may have made, it's almost your right to like have to let them know from that standpoint there. So again, you guys have. Oh yes, everyone has failures to overcome, but we have to be determined. Exactly, man. Like it's definitely something that I take for heart, because again, one bad situation, I could not be talking to you today. Like it's and I've had a few missteps along my way. But again, does that make me less of a doctor? Of course not, because I can tell you right now, I know I got friends who are neurosurgeons. I got friends who are surgeons, plastic surgeons, dermatologists, OB-GYNs, like family medicine. Like I got friends in almost every specialty that I know had trouble along the way. So it's and I think a lot of times especially for physicians, you tend to think that we're in this like perfect state of bubble. Oh, what's going on, Neville? You think we're in this perfect state of bubble, and I'm fully here to burst that very quickly for you guys. So again, I am Dr. Berry, your board certified internist, founder at drpiersblog.com. If you had not had a chance, again, I think we got like a week left to go ahead and download that free book, Affirmation 2016. Go ahead. I'll put a link in the comment section, but it's drpiersblog.com/free book. /free book. Go ahead and put your email address in there. Download the free book. I think that's about it. Okay, so I'm about to go run. I got some rounds in the hospital to do. Y'all guys have a great and blessed day. Remember, on Thursday, I think Thursday, we're going to be talking about Obamacare. We're going to give another quick update on Obamacare, and then we'll probably talk about something else, but definitely I got to give another update on Obamacare, because I'm having more and more patients kind of concerned now, especially now that it's, the ball is rolling in that regards. So y'all guys have a great and blessed day. Bye.